Hello and welcome back to Focus Atlanta. Thank you so much for watching. We are going to focus on health in this segment. I am here with Dr. Ken Redcross. We're going to talk a little bit about infertility. Thank you so much for coming on the show.
Thank you so much for having me, Keisha. It's so wonderful to be here in Atlanta. You have no idea.
It's a little warm here, I know.
It's very warm here. I love that. I love that. New York, we're having some weather challenges, so this is a good one.
Okay. Well, part of the things we're going to talk about are vitamin D. And vitamin, you're going to get your sunshine when you're here in Atlanta. So you might not have to worry about that. Dr. Redcross, I brought you on because so many people are having issues with infertility. You've heard about it in the news with a lot of celebrities and things like that. And often they jump straight to IVF, or they jump straight to doing all types of things, but they never really talk about the issue and what might be going on in the body.
They really don't. And we need to also talk about a little bit more of the natural thing. You've hit a very good point, Keisha. 7 million people are dealing with infertility every year in America. That's 1 in 6 couples.
That's a lot.
But instead of focusing on the negative meaning infertility, because there's so many negative connotations with that, I like to instead focus on becoming pregnancy ready. So much more positive in order to do that.
Okay.
When we do that, one of the first things I love to talk about with patients is our diet. Our diet is so important because we know that women who have diets that are high in animal proteins, trans fats, and carbohydrate, they have a harder time getting pregnant.
Oh, wow.
So it's important for us to swap out the animal proteins for more plant-based proteins, such as that of dried cooked beans or nuts. Low-fat dairy is okay as well.
Okay.
One of the other things we need to consider, and I know my Starbucks folks are going to kill me, but we have to back up a little bit on our caffeine. Just a little bit.
Okay.
The studies show 2 to 4 cups a day are not really good because they interfere with conception.
Oh, wow.
So something for us to kind of think about there.
Yeah.
But not only diet, Keisha, we also need to think about vitamin deficiencies. Vitamin deficiencies are important to address early and often. It takes about 3 months to get a healthy sperm.
Oh, wow.
One of the systems that I love is Fruitful Whey. It's a perfect name. We're talking about fruitful and getting pregnant. You can't really beat that. But
You're a little biased, but okay.
Okay. So as we deal and we think about something like Fruitful Whey, I love this system. It's a fertility management system because it makes it dummy proof.
Okay.
If you look at the bottles here, the one for the male says him. The one for the woman says her, and guess what, Keisha? The one for the couple says couple.
Okay.
Makes it very, very easy to make sure we know what we're doing here.
Dumb it down.
So they get it, they dumb it down for us. But not only that, the things that are there are important. The one in the female formulation has vitamin D, B12, B6, very important. Vitamin D is important for after the woman gets pregnant because it helps to stave off preterm labor.
Oh, wow.
The formulation for the male has L-carnitine and selenium. Once again, very important for the health of the sperm, for the motility to get to where it's going. But Fruitful Whey not only helps as far as with the vitamin supplementation, but it's also leveraged technology and has an app at fruitfulwhey.com, which is huge in the infertility world because what's happening is it's allowing us to do 2 important things. Number one, it tells the couple when to take the supplements and how many to take, so the guy doesn't have to worry
about.
The other thing is it allows the guy to actually log into the phone, into the app at fruitfulwhey.com and see when she's ovulating. So that way he can plan. He could bring home some roses, maybe turn on a little berry white.
Right. Add the romance back into this process as well. Right.
And that's why I love it, because it does that for you. It really brings back the romance when we're thinking about the fruitfulwhey.com app. But not only that, we also need to think about environmental toxins. I have to bring in the Zika virus. Now, Keisha, the Zika virus in itself does not cause infertility, but it does put off your family for at least 6 months because we know now the Zika virus can live in the male sperm for up to 6 months or in the testes. So it puts the family off a little bit. So make sure if you have to travel, you want to get insect repellent that has DEET, D-E-E-T, to kill the mosquito. The other thing we need to think about are plastics. Plastics are huge because they're ubiquitous, they're everywhere, but plastics can have bisphenol or BPA, which once again can be damaging to the egg. So you want to get BPA-free plastics. This is a water bottle in case you're an exerciser or that sort of thing. Also think about it when you're heating up food and plastics in your microwave. You don't want that to leach into your food. The other thing we want to think about here, one of your producers almost had a heart attack when I showed this cell phone, probably a nice millennial. The reason why I say that is because men who are on the cell phone for over 4 hours a day was kind of a double whammy. They have a lower sperm count, and not only is it low, Keisha, but it's a poor quality sperm on top of it. So dial back, spend time with the wife, make more love. That's the whole key anyway.
And
stop wasting time on the cell phone.
All right. well, you've given us all the tips that we need. Now, how do they find you? How do they, go? Is there a website or anything?
There is. They can find me at drredcross.com, drredcross.com, and also there'll be a little piece there about vitamin D, like you said, which is increasingly important to get pregnant as well. There is some more information there at thepowerofd.org about at-home vitamin D test kits.
All right, and so it's about our diet. It's about how we're taking care of ourselves, how about what we're putting into our bodies.
Yep, absolutely, because whatever you take into your body is going to be very important for you to get pregnant. So whatever you take, ingest, inhale, all has importance for the sperm and the egg.
Thank you so much for coming on the show.
Thank you for having me.
Eliminating some of the fear, right? Because all of it seems to be negative all the time, but it doesn't necessarily have to be. If you just know what to do, if you're just kind of paying attention to what you're putting in your body and the amount of time you're spending with the honey and off of the phone and those type of things, all of those things matter. Take the opportunity to learn a little bit more. Go to Dr. Ken's website and learn more. And stay tuned for Focus Atlanta. We'll be right back.